My name is Allison Jagger. I'm in the nursing program here at Washtenaw Community College, and I'm in my last semester, so I will be graduating this spring. To be honest, I was never interested in nursing. My mom always told me to go into it, and I'm a little squeamish around needles and blood, so I said no. And it wasn't until my brother, who was diagnosed with a really rare cancer, it was alveolar soft heart sarcoma. He had been battling that for about 6 years, and then when he went on disability, he asked me to move in with him to help out with some of his care, and he had a 5-year-old daughter and a wife. And after I had moved in, and it was after he passed that I decided to pursue it. And again, just seeing the impact that the nurses made. When he went through hospice, he was in hospice for a little over a month, and there was one nurse that was there the entire time, and just the way she comforted him and all of us and took such good care of him and educated us, and all of those things just really kind of put all our minds at ease, because it's such a roller coaster of emotions going through all of that for everybody. And so that's when I seriously started thinking about it and more. I never really liked school before, and that all changed once I started here. And I don't know if it was the subject material, that I had never, really taken an interest in science and things like that before, but I think a big part of it was the instructors, and so that kind of instilled a new motivation for me to get through. And for my med-surg, I went on an oncology unit, and having had the history with a brother with cancer and going through that, it really hit home for me, and it was emotionally challenging and challenging in terms of the work as well. And so I think that really reinforced why I wanted to be a nurse, to be able to be there for patients and their families when whether it's hearing a new diagnosis or going through the end stages of cancer or things like that. And there were days when I would come home and cry, and I went from that then to my nursing of the childbearing clinical, which was the complete opposite end of the spectrum. And I think that's just what nursing is all about. It's something to treat with a lot of respect, because these moments are ones that people will remember forever, and the care that you provide them during those times is also something that they're going to remember. So.